Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
Welcome to Petability. I'm your host, Kathy Simons.
And I'm your host, Chris Cranston. Our podcast provides interviews and information to help your pets live their best lives. We are thrilled to have renowned veterinary neurologist, Dr. Gena Silver, with us today to tell us about intervertebral disc disease. Dr. Silver earned her DVM from Atlantic Veterinary College in Prince Edward Island, Canada. She then completed a small animal medicine and surgery internship and a 3-year residency in neurology and neurosurgery at Washington State University, where she remained on faculty for 1 year as a clinical instructor in neurology and neurosurgery. Interestingly, Washington State University was the first veterinary hospital to have an MRI, giving her unique and extensive experience with this diagnostic tool. Dr. Silver is a board-certified member of the American College of Veterinary Internal Medicine in neurology, as well as a member of the American Veterinary and Medical Association and Massachusetts Veterinary Medical Association. Although she enjoys all aspects of neurology, her special interest is in disc diseases. Welcome, Dr. Silver.
Yes, welcome, Dr. Silver. I'm just going to jump right in with my first question here. Can you explain to the audience what is intervertebral disc disease and what causes it?
Hi. Well, I think the first part is just starting to define what does a disc do. And so in between each vertebral body for all of us, there is a disc, which kind of acts like a shock absorber or a cushion to keep each of those bones separated. And so the disc itself, if you look at it in cross-section, it looks like a jelly donut. It has a gelatinous center part and then a ligament fibery outer part. And so when we have problems with the discs, that can happen either from an injury, a traumatic injury, or a degenerative process where the disc over time is slowly breaking down. And so your clinical signs of disc disease is when you start having pain or paralysis from that disc where it's starting to rupture up or pop into the spinal column and put some compression on the spinal cord or the spinal nerve.
That sounds awful. I can imagine that would be painful. And
I think any of your listeners maybe have had firsthand experience with that themselves, so it is very painful.
And one thing that I think is unique to the animals, you mentioned about when there's compression that it starts to cause paralysis. That rarely happens in people, but it seems to be pretty common in pets. So what are the early signs that it may be starting to, besides being painful, be starting to cause that paralysis?
So the earliest signs, sometimes there's no warning. So sometimes certainly you can have some animals that have some pain that then starts progressing to them having trouble standing up. But sometimes the disc can erupt very abruptly. And so your clinical signs can be, I went to work, my dog was fine. I came home and my dog was paralyzed. And so your clinical signs have to do with a combination of the compressive component, so how much disc material pops up into the canal, and also with what speed. And so the concussive. So when the disc pops up, there's going to be a concussive, a bruising, an impact component. And then the second part is how much disc material, how much hemorrhage has happened with that disc extrusion. So combination of concussive and compressive forces determine clinically what we see in clinics.
Got it.
So that would certainly be an indication to seek immediate care, or that the coming home and finding your dog paralyzed, which would be terrifying. What else? Is there anything else that we would know that we needed to seek immediate care? Go to the emergency room. This has to happen. Is there a time frame for that?
Yeah. So I think, the hard part, what I always tell people is if to you this is an emergency, then you go to the ER room. Now, sometimes what a client deems as an emergency isn't clinically an emergency. So my guidelines are, if the animal can stand and walk, you're not in an emergency. And so sometimes the animal won't stand and walk because they're painful. And for clients, that can be difficult to differentiate, meaning my dog will not get up. But as a neurologist, I look at it, well, can the dog, or is the dog just not getting up because it's uncomfortable? So in general, if you think it's an emergency, go in, have a professional evaluate the animal and kind of determine where your baseline is. As a professional, what I deem as an emergency is if the animal can walk. If they're walking, you can wait. So if they're walking, it's not an emergency. If they can't walk, that can be an emergency.
And I thought that once an animal goes down, I think that's a term that is used in veterinary medicine, meaning that they are paralyzed, they go down, that there was a time frame, maybe like 24 hours, where if they need surgery to decompress that disc and get it off the spinal cord, where it's going to be the most successful. Is that true?
So basically the guidelines are not so much when the animal's down. So if an animal comes in and the animal's down, part of the exam is I'm going to support the animal and see, are you down because you have so much weakness you can't support your weight, or are you down because you're truly paralyzed and you cannot move the legs? And so there's different grades of being down. So if the animal is paralyzed, if I lift the dog up and there's no voluntary motor to those back limbs, I cannot move them. The second evaluation is, can you feel them? So if you can't move your legs, the next part is, can you feel your toes? And so with that part of the exam, we pinch on the toes, and we're not so much looking at the leg pulling in, because that can be 100% reflex, and that's based on where the injury is in the cord. So what I'm looking for is when I pinch the toes, is does the animal consciously, turn around to say, what the heck are you doing back there? And so as long as the animal can feel their toes, that means that we have positive perception to a noxious stimuli. They can feel pain. Then I know that the circuitry, the tracks, are still intact. There's still integrity. So even if the animal's paralyzed, if they have perception to a noxious stimuli, if this is from a herniated disc, because remember, there are other things that can cause an animal to be paralyzed. So if they have feeling, then with a herniated disc, the prognosis with decompression is 85 to 95% that we can fix that animal. If I pinch those toes and the animal pulls in, but there's no conscious, I can feel that, then we call that negative perception to a noxious stimuli, and that changes our prognosis. So in general, the statistics will say that if they are decompressed within the first 24 hours from losing perception, the prognosis is 50-50 that we can get them back up again. If the dog has been down with no perception and it's been greater than 24 hours, then the prognosis for return to recovery, even with surgery, is less than 5% chance.
Wow.
So your emergency comes to, can they feel their toes?
Yeah.
So that's kind of the really thing that changes, the perception, the expectations going into surgery.
Right. And I think that that's a difficult thing to assess. I don't think the layperson can determine very easily if they are feeling their toes or not. I find that that's a tricky test. I've seen it done many times over the years. And so back to the whole having an expert assess them.
Yes. And I would take that beyond sometimes even the owner, that sometimes general practitioners, because if an animal has a good reflex, boy, they can pull those legs in quickly. But what you're really looking for is, are they turning around and like barking at you that hurts? And something that I'll show the owners just to kind of show them the difference is pinch the front toe. So in the front toe, the leg is fine. So compare your reaction to pinching the front toe to pinching the back toe. And then that can become more clear.
Yep.
Dr. Silver, who gets intervertebral disc disease? Like, is there a breed disposition? I mean, I have pugs, so I'm always like, is my pug IVDD? I'm always worried about that. So who gets it? Who's predisposed? Who gets it? And are there other animals that get it? Do cats get it? Can rabbits or iguanas get it?
Sure. So basically what I'll tell my owners is that any dog, breed, size, shape can have intervertebral disc extrusion. However, majority of the dogs that we see, the dogs that are predisposed to it, are going to be the chondrodystrophic or the dwarf breed dogs. And so that means the dogs that have short, curvy legs. A lot of the times people think it's their long back. It has more to do with their stature of their long bones. And so any of these short stature dogs, the Dachshund, the French Bulldog, the Corgis, Lhasa Apsos, Shih Tzus, any of these chondrodystrophic dwarf breed dogs are more prone to disc extrusions. And the reason being is that in those breeds, the center part of the disc, the jelly component of the disc, tends to calcify and mineralize at a very early age. And so it is not abnormal for me to see, a year and a half, a 2-year-old French Bulldog or a wiener dog come in with a disc extrusion. That would be like a 7-year, 10-year-old child having a herniated disc. That doesn't happen. That's not normal. That's not trauma. So I will not see that in a Labrador, but these chondrodystrophic breeds, because of the degenerative process of their discs that's going on, just breed predisposition, they are prone to it. So if I see a Labrador, I tend to see them as they're middle-aged or older, and that often can be more of an injury-related disc extrusion.
That's fascinating. I don't think I knew that.
I don't think I knew that either. Learned something. That's great.
That's absolutely.
Good.
So you said that, you're talking about the conformations and being the short or dwarf dogs. What about the other species? What's the most exotic animal that you've treated that has been definitively diagnosed with IVDD?
Well, I guess for me, it's probably see 85% dogs. We do see some cats. Cats do have disc disease, not as prevalent as dogs. As far as exotic species, I've certainly worked with turtles, seals, penguins, but to be honest with you, none of them have had disc disease. It was for other infectious, cancerous, spinal cord conditions. So none of them have had disc issues.
Interesting.
I want to do physical therapy on a turtle. If that happens, you send them my way, okay? I'm into that.
Yeah, turtles tend to be more the boat strike, so they tend to have more fractures. Yeah,
you can still send them my way.
Kathy, now that we're older, maybe we can keep up. We can keep up with the turtle.
Yeah, right. Doctor, are there dogs out there that are living full lives with managed IVDD?
Sure. So, disc disease or, a dog's having a disc flare-up, it doesn't always end up that they're in surgery. So in general, as I mentioned before, if you're walking, you can wait. So if the animal's up and walking, even if they have some degree of paralysis, if it's just pain, and I'm not belittling pain, but we have drugs for pain. So if it's a pain thing, we always start with strict rest, an anti-inflammatory, be it a steroid or a non-steroidal, gabapentin, some pain medications, and strict rest to see if over time, can the inflammation associated with that disc, can they live with it? And certainly there's lots of animals that can live with it. Other parts that go along with the strict rest is, if we're a month into it, things are going great, we slowly start picking up the activity level. And just some basic guidelines, even if you have a dog that hasn't had disc-related issues, but gosh, I have a breed that's prone to it, my motto is 4 on the floor. So keeping the animal off of couches, beds, so no jumping, no stairs. I always think exercise is better, working your way up to some nice, vigorous, long leash walks. So my analogy is think yoga and swimming, not soccer and football. So no fly ball in the backyard, no crazies, twisting, turning. So those are just kind of some modifications of dogs that I've either had clinical signs of disc disease that didn't require surgery, or just some basic guidelines that give owners who have breeds that are prone to having disc issues.
So Dr. Silver, you've talked a lot about low back issues and having disc disease farther down in the spinal cord, which affects the back legs. Are there other areas of the spine that are prone to disc problem?
So in general, I would say that you can have disc-related issues anywhere in the spinal column. I would say that there's an area that it's less frequent, which is in the thoracic region of the rib cage area, from the first down to, we have 13 ribs. And so from the first to the ninth rib, it's a very abnormal area to have disc-related issues through there based on anatomy and structure. But we do see cervical or neck disc issues as well. And those clinical signs can present as neck pain. Certainly they can present as animal having trouble walking in all four legs or knuckling over in a front limb. But a lot of the times they present with their neck held down and their back is arched like a Halloween cat. And so often people think it's a back problem because the back is arched. But in these animals, their back is arched because the neck is held very low because they can't put their neck up in the air. Interestingly, these guys will also, when they come in from outside, instead of doing a nice full body shake, they do kind of a gentle shake or half a shake. And some of these dogs even stop barking because it's interesting on how much movement the dog puts its head and neck in when they go to throw their head up to bark. And so all of a sudden the animal will stop barking because they can't use their neck to bark because it's painful.
Wow. That's amazing. Yeah. So how do you manage these dogs that have the pain in their neck? Do they have surgery as well, or is it typically through medications and things?
Well, we'll often start with, again, the rule of if they're walking, they can wait. So if they're up and walking, we will often start with pain medication. Again, combination of an anti-inflammatory, be it a steroid or a non-steroidal, some gabapentin, tramadol, some other pain medications, as well as rest. Usually I'll tell people if after a week on the combination of medications and rest, if it's not getting better or getting worse, then medical management is failing. And so when medical management fails, the next step is looking at doing some imaging to confirm that it's a herniated disc, because there are other things that can cause spinal pain, paralysis. And if it's a herniated disc, at that point, we already know we failed medical management. So the next step is going to be discussing surgery to remove that disc. I would say that the majority of disc surgeries I do for neck issues, it's because of pain. Some of those animals have paralysis, but a lot of neck surgeries are for pain management. Compared to back surgeries, a lot of times we take those dogs to surgery. It's because of a more obvious degree of paralysis or the animals being paralyzed. So they certainly do present a little different, and certainly the necks may not appear as severe clinically, but pain can be very debilitating and affect quality of life. Now, the positive part is with the neck surgeries, those guys don't have to learn to walk again. And so my analogy of that surgery is it really is like taking a rock out of your shoe. So when the rock is there, it's very painful, but once you pick the rock out of your shoe, you're good to go. And I do find with disc surgeries in the neck that these dogs heal up very quickly, and it's a very instantaneous, relief of pain.
Sure. Versus our back surgeries need to learn to walk again and have rehabilitation to walk again. It's a more prolonged recovery phase for them.
Mm-hmm. And it seems to me, in my experience, that oftentimes there are these older dogs, maybe 10, 12 years old, that are starting to show some signs of maybe having a disc, but it seems like when they've had a neuro consult that they're not recommending anything invasive at that point. Can you speak to those guys?
Sure. So we certainly have many of those dogs present as they're 10, 12, 13, 14, and over time it's getting harder to get up. They're having some degree of back pain. And so it's hard to, flick a switch and quickly fix something that's been building up over time. So it's, in general, I'll say as a neurologist, the spinal surgeries where we're going to have the most success is the quick on, quick down, quick fix, quick up. The chronic, progressive, waxing, waning, that's chronic degenerative issues. And so it's just like, when 85-year-old Papa is having trouble getting up, trouble moving because of, things that have happened over a lifetime, those things are hard to fix and reverse. And so sometimes in our older animals, sometimes doing an MR scan and seeing if there's multiple disc protrusions, which one do you go after? And I'll often say just because you can, it doesn't mean you should. So you really have to look at the entire patient, try to decide what expectations are in this case, what's going to happen if I take this dog to surgery. And certainly there are many of these cases that you will do more harm than good. And so those type of patients, often it's how do we live with this? How do we make them as comfortable as we can? How do we adjust their day-to-day life to compensate? So good traction ground, short, frequent walks, not overdoing it. What kind of medications can they live on safely over time? It's never going to be normal. It's just going to be how do we make what we have as good as we can.
Mm-hmm.
I'd love to hear your thoughts on incorporating physical rehabilitation into the IVDD patient's treatment plan, either post-op surgery or as conservative management. When I started as a technician, not only did we not have access to things like diagnostic tools like MRI or CT scan, we didn't have access to, laser or, the idea of using core strengthening for these dogs, any of those things, ultrasound, acupuncture, chiropractic. We just didn't have access to it at that time. And it's so exciting to see that not only do we have these great diagnostic tools like the access to MRI, but to access to physical therapy as well. Do you have any thoughts about incorporating that into a patient's plan?
Yeah, and so I do think that it's not one size fits all. So, it depends on the case. It depends on what the process was. And so again, with these discs that extrude in the neck, where it's a quick recovery afterwards, that animal does not need physical therapy. The animal that comes in with the acute disc rupture that was down at the time of 2 weeks post-operatively, if they're doing great, that animal is not often the client will send for PT. So the animal I'm going to send for PT is, again, I'm looking at the whole case. So how long has the disc issue been going on? How did surgery go? How's the animal recovering? What's the owner like? What's the owner's ability to help this animal? So the one beautiful thing about animals that is very different than in people is that animals have no gain on being sick or not being active. They don't get to stay home from work a little longer if they need, an extra 3 weeks at the rehab center. So an animal wants to get up. They want to go out for their walk. They want to be active, and attitude's everything. So that's huge. So the animals I think I'm going to send for physical therapy are the animals that just are taking longer to recover. Maybe it was a more chronic issue. Maybe I don't expect that this animal's ever going to recover back 100% on their own. Maybe the owner has got some physical disabilities that they can't help get the dog up. They can't help get the dog outside for those short, frequent walks. Maybe the animal at 2 weeks post-op really doesn't have enough strength to support itself, and the buoyancy of the water is going to help get that animal up. So it really is, looking at the whole picture. And, to me, PT for some of these disc issues is not an automatic. It's depending on who it is, what scenario, and is the PT going to be that cherry on the sundae to take them to the next level?
And the animals just don't have that emotional baggage maybe that you and I might have from recovering from spinal cord surgery. And the other thing that I like so much about therapy, not only do I have access to all these modalities, but I think there's also this emotional component to it, this piece where dogs get to come in, they have time with their owner, they have time with me, we do massage, things that feel good, floating in the water feels good. So I think even though they don't have an emotional baggage, I think that maybe even just that sort of stimulus of that environmental enrichment of coming in and getting attention and feeling good when you left is nice.
Yes. Yep, I'd agree with that.
And to Dr. Silver's point too, I think that any good professional, whether it's veterinary or your own doctor, doesn't just have a cookbook recipe and how they treat things. So I really like the idea of looking at the individual case, not only the pet and how they're doing, but also the owner, what they're capable of. Finances are a huge issue in veterinary medicine. And, so when people are looking at thousands of dollars for a surgery, and then adding monies on top of that for physical therapy, that can, be difficult. But in the big scope of things, the physical therapy seems to be a pretty good deal as far as what they get for the money. So anyway, I appreciate that, Dr. Silver, that you're just not sending every dog that you see with IVDD to physical therapy. So that kind of brings us to maybe concluding with your best success story. Have you had?
Love to hear success stories. My favorite.
Yeah. Well, it's funny because, I love doing what I do because there are so many successes. And if we had more failures than successes, I'm not sure that I could do it because it is very expensive. It's a lot of work for the owner. And so I do think up front it is, again, assessing the patient and being honest with the owner as far as expectations and who's a good candidate and helping them make some difficult decisions, which, again, I go to work, animal seems fine. I come home, my animal's paralyzed. And, again, that is such a shock. So helping owners make some educated decisions is very rewarding. So as far as the ones that make me smile are, sometimes we have dogs that come in with neck pain. We've scanned, cut, and had them out of there within 24 hours, going home with that rock out of the shoe, feeling fantastic. Nice. I've had some animals come in where, they're paralyzed with no perception, 50-50 prognosis, and it's hard because 50-50, that's a tough one because, gosh, do I spend $8,000 and, 50-50 is not giving me much to go on. It might work, it might not work. And so we all want to be on the upside of the 50-50. And so when we're on the upside, it's so rewarding. When we're on the downside, it's disheartening. So to me, every time they come back 2 weeks later and they're up and walking, that's success. That's happy. Everyone's thrilled. And so when the dogs that are paralyzed with no perception, when they get better, those are the ones that, everyone's happy with. So they're all, we enjoy all of them.
That's why I went into rehab. I love that. I love that feeling of seeing a dog recover and get its life back, and then being able to engage in things that bring that dog joy. Even if it's just, going for a walk or sniffing or sitting out in the grass, just being able to see that dog engage in the things that bring happiness or joy to that dog and to that family. It's what I love.
Definitely.
I also wanted to comment on, we've talked about MRI, we've talked about surgery and so forth. For our listeners that are in other areas of the United States or even the world that don't have access to some of these things, where do they go? What do they do? And, are there certain credentials they should look for in terms of, maybe they go to their veterinary school to find somebody that is, a diplomat status. Is that crucial, Dr. Silver?
Yeah, so I think once you get to doing neurosurgery, I truly think that you need to be with someone who is board certified. I would tell you preferentially a board certified veterinary neurologist. As far as veterinarian surgeon, it's a bit of can they do back surgery? Certainly they have to have had exposure to enough back surgeries to qualify to sit for the boards. However, you don't know whether that person's qualification was looking over somebody's shoulder watching the surgery or whether they do them on a regular basis. And so when I give statistics to owners as far as my outcomes, these are based on doing, multiple of this kind of surgery per week. So I would always say your best bet is to start with a veterinary neurologist. If you're in an area where there is no veterinary neurologist, then I guess maybe asking that surgeon, how many backs do you cut per week, per month? And you want somebody who's doing these on a regular basis. And so it's definitely, there's an art and a science to it. And so the more you do, the better you are. And as far as this is not something that a general practitioner should ever be doing, it is a specialty trained field. And so, I would avoid someone who is not board certified. And if you're not close by, definitely go to a vet school. You'll be in good hands there. I guess those would be my recommendations.
We are so lucky, so privileged to be in the New England area where we have access to all of these specialties. I'm from Iowa originally, and when I go back home and I talk about my dog going to the cardiologist and my cat going to the oncologist, and they're blown away. They can't believe it. So we're very privileged out here.
Yes, I would agree. I'm from a small town in Canada. I get the same. The eyebrows go up when I tell people what I do for a living.
We truly are. And if there isn't one technician out there that doesn't have a pet that needs a cardiologist, neurologist, ophthalmologist, that's how I get my Christmas cards out by order, neurology, ophthalmology, cardiology. Yeah. I think my pugs are the cornerstone of their practices.
Yeah. Yeah.
So, Dr. Silver, how can our listeners find you?
So I'm at the Massachusetts Veterinary Referral Hospital in Woburn, Mass. And you could just look it up through the hospital, or you could probably just look my name up. I've been Wonderful. Here for 20 years, so I think I'm on the internet.
Wonderful. Thank you, Dr. Silver.
And I just want to say, too, that hospital has a number. It's specifically an emergency and specialty hospital. So it is filled with board-certified specialists, and I think you have several colleagues even in your neurology department. So it's, again, a real privilege to have that nearby.
Yes, we've grown a lot in 20 years, so I think we pretty much cover every specialty, and there's somebody there that can help you 24/7. So it's a great resource to have in the New England area for sure.
And you mentioned 20 years. You've been there from the beginning. You were one of the first specialists that they hired.
I sure was. We've come a long way.
Awesome. Yes. Well, it's been such a pleasure speaking with you and learning about intervertebral disc disease. You gave a lot of information in a very clear fashion that I think our listeners will appreciate.
Great. Well, thank you both for the opportunity.
Thank you. Thank you for joining us. We hope you enjoyed our show. Follow us on Facebook or on Instagram at Petability Podcast.
For more information about Kathy's books and living with blind dogs, please go to enableyourpet.com. Thank you, and please tune in next time.